All right, welcome to today's call, everyone. It's 10 o'clock or a little after, and so we'll dive right in. Today's agenda will be pretty simple. Sorry for a little technical difficulty there. We're going to go over just some of the basic uses of Zoom and some of the ways we'd like to ask you to use Zoom to help ask questions and chat with each other. We're going to cover some ground rules on behavior, offer some really basic definitions to make sure we're all using the same terms when we're asking questions and having our discussion. And then we'll hear from Dr. Sean Murphy from Tucson ER, who's very graciously volunteered his time here to help answer any questions you guys might have. When you're using Zoom, there's a few tools. There's a chat, a question and answer, and a raise hand feature. The chat feature has the ability to message just panelists, which would be Dr. Murphy and the CWA staff, or you can change that box to chat with all panelists and all attendees, so you can share some thoughts with each other. If you do have questions, it's best not to put them into the chat window, but to actually use the question and answer function, which is in the center lower right of your screen, right to the right of the raise hand button. These questions can be upvoted, so if you have a question in your mind that's already been asked, just upvote the previous question and we'll do our best to make sure it gets answered. You also have the ability to type in some thoughts and answers to everyone's questions on your own as well. And if we do so during the question and answer period, if anyone has any insights they'd like to share, you can raise your hand and I'll unmute you so you can speak with everyone. And when you get unmuted, you'll have a small pop-up that shows up. Just click unmute myself and then you'll be ready to talk. The ground rules for today's call are pretty basic. We just want everyone to be polite and respectful to everybody, including Dr. Murphy, the CWA staff, and each other, both in the chat and if you're speaking out loud. If we do unmute you after you raise your hand, please limit your comments to 2 minutes just to allow time for everyone to speak. And I don't think we'll be in too many dangerous areas here today, but yeah, please no personal political commentary as much as possible, just to help keep the conversation rolling and focused on the medical perspective. Anyone who's abusive in the chat or question and answer boxes, we will remove just to keep everyone's experience as positive as possible. As we're talking about these things, some of the terms that'll come up over and over again would be cleaning, disinfecting, and hygiene. And I just wanted to make sure that we're all using the same terminology there. So cleaning is the first step towards disinfecting, also just a lower level than disinfection. And the goal of disinfection obviously is to kill any microorganisms or deactivate any viruses that are present on surfaces. And then hygiene is just referring to the general practice or activity that anyone might be undertaking to keep themselves clean and to keep their environments clean. As I mentioned, our presenter today will be Dr. Sean Murphy. He's been climbing for 7 years and started his career before he started his full medical career, he began as a volunteer firefighter and EMT. He's currently an emergency medicine physician in Tucson, Arizona, and on the front lines of this entire issue. So without further ado, I'll hand this over to Dr. Murphy, and we'll begin his presentation.
Oh, thanks for the introduction. Do we have is there an indicator of how many people are here, roughly?
Yeah, we have a little over 100 people on today's call.
Cool. All right. Well, it's a pleasure to be speaking with all of you. Thanks for the introduction again. I guess I just want to put forth this notion that, again, as was mentioned, I'm an emergency room physician, so my expertise is in treating patients at the bedside. I'm not an infectious disease expert or a public health expert, but these are all elements of what I deal with daily and have been learning more about and utilizing in clinical practice at the hospital here in Tucson. So I'm happy to help out however I can and provide some guidance based on what I've found and what is evolving in the literature regarding this outbreak. So, yeah. So I think you put together a couple questions that kind of get started, which we can address, and then just happy to answer questions as we go and take it from there. Does that sound reasonable?
That sounds perfect. Thank you. And just as a reminder for everyone, and some of you are already doing this, just start typing in your questions as we start the conversation. And once we move to the question and answer portion more fully, then we'll make sure as many as possible get addressed. And yeah, that sounds like a great plan, Dr. Murphy.
Okay, cool. So before we dive into that, I guess part of what we should just all get on the same page is that the reason there's so much confusion regarding this pandemic, the coronavirus, is that we've never seen it before. It's a novel virus. It's never been studied, looked at in any scientific controlled setting in humans or out of humans. So that is part of why we're all learning as we go. And with regard to each specific issue, like sanitization, its survival on inanimate surfaces, the natural history of the disease when it affects certain demographics of people, we're all finding it out for the very first time as we're moving along right now. So that's part of what the challenges have been for various industries like the climbing industry and even the hospital industry, knowing what's the safest way we can deal with this virus, what's the safest way we can protect patients and healthcare workers, and then businesses are, all struggling. Bars, restaurants, stadiums, music venues, all those things are struggling with all the same questions. So we're learning as we go, and there might be some areas where new information comes out literally within days, and that's the first time we're finding out anything about the nature of the virus and its ability to survive, et cetera. So with that, first question that you put forth was, how long will the pandemic last? There was just a report that was broke by a federal report broken by the New York Times, so weigh in by the CDC as well, that we're thinking likely 18 months that we're going to see widespread disease. Although differs geographically, when will the bulk of the disease be peaking in different areas. So right now, I mean, I think some folks have been we're seeing a pretty big spike in New York City. I mean, obviously Seattle was hit already pretty hard in their increasing number of cases. We have a projection here in Pima County in Arizona that will likely see the most severe disease in about a month from now, month to 45 days. That's all projection based on epidemiologic data and presuming no breakthrough, medicinal therapy is discovered, which we can talk about a little more about what we're thinking about that. But so that's that question. So the next question you put forth, how to practice good hygiene while climbing. So I guess this kind of ties into a bigger question about the contagiousness of this disease overall. So some folks might have been hearing the infectious disease or epidemiologic term, the R-naught, which is a statistical tool we use to try to measure or quantify the contagiousness of a disease. So the R-naught of this COVID-19 disease, or the SARS COVID-2 or coronavirus 2 disease is thought to be between 2 and 2.5, which means that for every person who's infected, we expect that they'll double or close to triple the number of infected people. And that ties into what constitutes good hygiene, or what can we do while climbing or in climbing gyms specifically to try to minimize or make that R-naught closer to the lower end of the range. And that poses two questions then. So Obviously, I think all of you are smart individuals and cool people. Generally, that's how I find the climbing community to be. So I hope that that it goes without saying, but anyone obviously that is having any symptoms shouldn't be climbing. Any upper respiratory symptoms, whether or not they've received a test for COVID-19 or not, should definitely not be climbing. Probably not and outside or inside. So that's one thing. It's fairly obvious. But I guess to answer this more broad question about how to practice good hygiene in the gyms is, what are the modes of transmission? So there's some experimental data suggesting that there might be some airborne nature to the coronavirus, meaning that it can hang in the air for a prolonged period of time. Again, that's experimental studies that have looked at how long the virus can be suspended in air, and that's thought to be at most 3 hours. But generally in the healthcare setting, we're considering the coronavirus to be a droplet transmitted disease. So that means coughing, sneezing, or direct contact with somebody who's infected. So that could also mean that you're talking with somebody, and I spit when I talk sometimes. I guess that's something that happens. And if one of those droplets ends up on your mucous membranes or on a surface that you then touch and inoculate yourself, that is the mode of transmission. So that's where the 6-foot rule comes in that you're hearing people throw around. Stay 6 feet away from people. That's because that's likely the distance at which you do not have to worry about if you're conversing with somebody, a droplet inadvertently ending up on you and causing you to obtain the disease. So that's the first part of it, is droplet isolation. So social distancing is this new word that we never used before. In our common vernacular, everyone's talking about. That's the justification for that. So now droplets, again, we're talking about, these are not visible droplets necessarily. They're just tiny, tiny droplets that contain virus. So those can also, when coughed out or spit out or sneezed out, can wind up on surfaces like climbing holds, like desks, like check-in stations, tablets, inanimate surfaces. And our best estimate, which varies by material, is that can remain as infectious material for up to 3 days if just left alone. There's some studies showing that maybe cardboard is safer. They can't survive on cardboard. But either way, 3 days would be what the best data we have right now goes to show. Now again, studies are coming out all the time. People are doing small controlled trials in the lab, trying to figure out if we can validate this or test different materials. So that's the best available data we have to work with right now. So in light of how to practice good hygiene, surfaces being wiped down and cleaned, anything that could have a droplet be introduced to it by a climber coming in to the gym or anywhere. There's at least one study that looked at in South Korea the different surfaces that were contaminated in public settings where people were found to be infected with COVID or have the COVID-19 disease, and literally everything, toilet handles, urinal handles, sink handles, soap dispensers, surfaces, doorknobs, literally every single tested surface was found to have active, viral components on it. So something to keep in mind, that this is going to be a big challenge for climbing gyms or any business to really have certainty that they're going to not allow this virus to be transmitted. It's really, really going to be very, very difficult. Not to say insurmountable, or not to say that we can do a lot of things to reduce the risk or or at least reduce the inoculum or the quantity of virus transmitted. But just throwing it out there that we're looking at something that's going to be quite challenging. So back to, so again, we're talking about good hygiene. That means obviously screening out anyone who has symptoms. The other thing would be somebody sanitizing their hands, which is probably the most common way that this is transmitted now beyond the droplet and airborne precautions. So sanitizing everyone who comes in and having that available at any place somebody is going to be climbing for continual sanitization of their hands, I think would be at a minimum a good idea. Now, so this would be the next section here. So I would want to put it out to the group or others here, how to clean holds. I have no idea how are holds currently cleaned in the climbing community or among different gyms. What does that process look like? Because I have no idea.
Yeah, there's a number of different methods that we'll see put in place a lot. One of the most common ones is pressure washing, both with or without any detergents or soap. And then various soaking methods, dishwashers are occasionally employed, and there are some dedicated hold washing machines as well, which are fairly analogous to dishwashers.
Okay. 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 And is there any what is typically used, just mild soap, or is there any products or chemicals used, or is that?
Yeah, let's put that out to the audience. If anyone would like to share, you can raise your hand and we'll unmute you for a bit. Yeah, in my experience, it's a lot of mild soaps. In the past, and still somewhat occasionally, people will be using muriatic or hydrochloric acid at various concentrations, and vinegar is also a common tool as well.
Okay.
Look like we have one person with their hand raised. Juan Arboleda, if you'd like to answer that.
I'm sorry.
Oh, guess a different question. All right. So with pressure washing, without any detergent, there's a small amount of heat involved. Is there anything we know about how hot something needs to be to deactivate this virus?
So so I think generally you'd want to get it to boiling temperature to be safe. I would have to dive in and actually look at if there has been a specific study done on that. However, as we know, we do know it's already with autoclaving technology, when we're trying to eradicate our reusable tools, it's a very thorough process. If you're using heat alone to deactivate infectious organisms, you really have to get to very high temperatures, boiling temperatures for a sustained amount of time. I would say most of the time in a non-pandemic situation, that's probably reasonable for just reducing the bioburden on holds or other surfaces. But as you can see, I've seen some footage online about what they're doing in China. They're actually spraying, disinfectant chemicals on public surfaces and in attempts to eradicate viral burden just from the immediate environment. I think that would be more what would be necessary to ensure true, sanitization and disinfecting.
Yeah, perhaps an interesting thing to have you weigh on rather than the cleaning, because I do think the cleaning of holds will probably be a bit of an ongoing discussion in the community. The CWA is planning on publishing information on that in the future after there's enough research and enough conversations with manufacturers to offer good guidance there. One thing that you might have a unique perspective on is just the surface of a climbing hold, the rough nature of it, the impacted chalk, and whether that type of environment is more dangerous than other high touch surfaces, which might be smooth, like a stainless steel door handle, for example.
Yeah, absolutely. No doubt about it at all. That climbing holds are going to be much more difficult to completely disinfect. than an inanimate, clean surface like glass or stainless steel. So there's a few different strategies that might be able to be employed. So one thing we're doing right now, you may have, I think a lot of people have seen that we're having major shortages with personal protective equipment nationwide and worldwide, really. And so one thing we're doing at our hospital, sort of funny, but we're taking our N95 masks and exposing them to UV light for 30 minutes, and I can provide some more details about that. But UV light is a strategy that does kill coronavirus and other pathogens when exposed with enough intensity and length of time. That's used in the surgical field to decontaminate operating rooms, but in this case, it's kind of a makeshift way for us to decontaminate our masks since we can't order new ones. So we're hanging up our masks on a clothesline and exposing them to UV light for 30 minutes on each side. So UV light obviously requires that the light, reaches where the surface of where the pathogen is. If it's packed under, a layer of chalk, then this obviously won't be effective. So going to need to see a combination of probably, ridding the surface of any chalk that would provide a barrier to either a liquid or light. Before using that strategy, but that might be something, that could be looked at. Another paper that was put out was actually looking at how sunlight might be effective if you're in a sunny enough climate and it's feasible. Certainly in Tucson, this is something that we could do if needed. Would be utilize sunlight and just time for degradation of the virus. So
yeah, I would just make one comment on that with the UV sterilization in the climbing environment. A lot of the materials we use are polymers and plastics, so the effects of UV light on something like a climbing rope or harness hasn't been tested very extensively. So with UV, and correct me if I'm wrong, Dr. Murphy, as a disinfecting practice, there's two components that make that successful. One is the intensity of the UV light, and the other is the exposure time.
Yeah, exactly.
Yeah, and when it comes to protective equipment like harnesses and ropes, I would caution people to go and start doing that without contacting the manufacturers. Climbing holds are a little less risky in terms of what kind of effects UV light can have on them. Is something we're trying to discuss with manufacturers. But one thing that you could definitely see with climbing holds at different UV exposures would be fading of the colors for certain urethanes. So another ongoing discussion that the CWA is going to be having and publishing guidance on. But at this moment, UV light, I would say, it would not be the first place that a climbing gym should go. There just isn't enough evidence out there, enough studies done on what the dangers are there.
Yeah, I totally agree. I would not use those on any life-bearing stuff. Like you mentioned, harnesses, anything that's braided or material. Again, I'm not a material scientist. That's not my area of expertise. But for inanimate surfaces that may be more difficult to clean, like N95 respirators or climbing holds or
shoes,
climbing mats.
Yeah,
or shoes. Anything that is a large area that may be difficult to get every nook and cranny. It's a reasonable strategy for, again, reducing that bioburden or the inoculum that's on the surfaces.
Okay. So we had maybe we should jump into some of these questions more directly that people are typing in. One of the most popular questions here is, how is this going to change the way users interact with the gym once we reopen? Should we be cleaning holds on the wall, not renting shoes or chalk bags?
So I think that, personally, this is a lot of speculation, but this is, I hope anyway that this is a pretty big wake-up call to our society about the potential for things like this to take hold and spread so quickly, like we've just seen. And luckily, well, you could call it lucky, but luckily the morbidity mortality for this particular strain of coronavirus isn't that bad in the scheme of different types of coronaviruses or other infectious diseases that have been pandemic in the past. So I think kind of a good wake-up call for our society, not only for emergency preparedness or preparedness for similar events, but also for activities like climbing or other gyms, knowing that they could be vectors, and a lot of the pieces involved could be fomites for transmitting disease. I think we will see a cultural shift, and I think climbing gyms and the climbing community adapting to meet that as good stewards of public health would be wise. So yeah, I think having which could be as basic as just good a good protocol for cleaning the climbing holds, cleaning reusable equipment, and encouraging hand sanitizer use before touching any of the shared surfaces, good hand hygiene, those things, probably the highest yield.
Dr. Murphy, when you're saying, when you're using the word cleaning in this context, are you thinking of sanitization, or are you thinking of just like how we defined cleaning at the beginning of the call?
Yeah, well, so I guess just taking a zoom out too, to everyone here that's involved in this discussion, I think the decision whether or not to close gyms or how we can make a gym as sterile as an operating room, I mean, it's not going to be possible. And I think to a certain extent, a lot of those decisions are probably not going to be in our hands. For instance, here in Tucson, we have mandated closure of our restaurants, bars, and our climbing gyms well, there's only 2 of them here, but they're both closed. So I think municipalities that have outbreaks and a steady rise in cases like we're seeing, I don't think staying open is going to be an option. Unfortunately, I think that's going to be out of our hands. I think for those that do make the decision to remain open, that at any part of this process, I definitely think something more than cleaning is probably going to be the only ethical way to proceed, I would say. So yeah, that would mean something more than just pressure washing, probably using a disinfectant of some kind on the different reusable touched surfaces. And just as a piece of guidance, the EPA does have a published piece of guidance that is updated continuously, where they actually have a list of all the different disinfectants that they certify are effective against the CoV-2 or SARS-CoV-2, the virus that causes COVID-19 disease. And there's literally a bunch of them then, and they list them, the different possibilities. So some of them which may have been already tested on climbing holds or are products that are available that you guys already know work fine and aren't too harsh. And they range from everything from hydrogen peroxide to bleach preparations to quaternary ammonium compounds. And I can, after this, provide a link to that. You can pretty easily find it too, but for some guidance on that.
Yeah. One of the things I'm concerned about for climbing gyms is any stigma that gets imparted on us after this is over, whether people look at gyms, fitness gyms, climbing gyms, even restaurants as more dangerous places or more risky places. Do you think that that's something that's warranted and something we should be paying extra attention to, or would you not find a climbing gym to be necessarily more risky than a grocery store or a bank?
Well, to answer that question, we really have to answer the question of what is our goal in taking any protective measures or preventative measures. So as you can tell when we're talking about how long this virus can persist on surfaces, how easily it can be transmitted, and also how you've probably read the reason it's spreading so quickly is because a significant percentage of people infected have no symptoms at all. They feel completely fine, and those are generally going to be young people, so generally going to be people in the demographic of climbers. Young, healthy people could have be completely infected and contagious and spreading the virus unknowingly to other people. So I think, to be realistic, again, you may have also heard that at this point containment is not possible anymore. We're doing essentially damage control and trying to flatten the curve, which everyone has been talking about. And essentially what that means is taking deliberate steps to help protect the vulnerable in our population, in our society, which is predominantly immunocompromised, people with lung disease, and the elderly. So you have to have that in mind to know how, as the climbing community and climbing gyms can respond to this and be good stewards of the community. That's the goal, because probably half of us on this webinar right now are going to be infected, and that's just the reality. Epidemiologically, and that has nothing to do with us being good or bad people or anything. It's going to happen. So the question is, how can we slow that spread to a point that we can deal with as a society, mainly from a healthcare perspective? Can we take care of the influx of patients who do actually get severe disease and require some type of treatment, such that we can ride this out together without causing major upheaval and more deaths than need to happen. So I think, and with that goal in mind, our goal should not be that we need to turn every climbing gym into an operating room, level of cleanliness. We need to do everything we can to reduce the rate of the spread by taking as many precautions as we can to allow that to happen. So that might include shutting things down for a period of time. That might include implementing some new measures that have not been common or in the culture of climbing gyms, like sanitization measures, like cleaning holds, and I don't know, but the other thing to consider would be that obviously your mouth gets really close to climbing holds when you're interacting with them, and that's another source of droplet that could form on holds for a subsequent climber to pick up and then inoculate themselves. So it's important to keep all of that in mind in order to understand what the goal is here, because it's going to be spread, and like I said, half the climbing community is going to get this virus. Probably all of them, but a small percent will be completely fine. It's just, we're doing this to protect the vulnerable in our population and to reduce that spike or that acceleration of cases all at once.
Okay, thank you. To kind of build off your earlier comment and to answer a question that's been asked by one of the members here, they were asking about comparing this virus to the flu, and I wouldn't want to get into comparing the communicability or the mortality or any of those numbers, but referring to the statement you made earlier, which seems like the general consensus for World Health Organizations is that we're not in a containment situation anymore, and this is potentially a virus that we'll be living with for the foreseeable future. So I'd be interested in hearing your thoughts about general attitudes towards hygiene and about the flu even, and how that might relate to ongoing attitudes towards COVID-2 and our sterilization practices.
So you mean your question is about?
Yeah, I'll read the question here in totality. It says,
Sure.
Can you talk a little about how this virus compares to the flu? Specifically, the flu is something that we have learned to live with, and general cleaning hygiene has been enough. What is the likelihood of the climbing gym community being able to go back to business as usual? Or is this going to change the way we do business forever?
No possible way for us to know at this time. I think the difference there is that we've been living with the flu for, we've been studying it extensively for a very long time, at least 100, over 100 years. We have all kinds of data about it, and also the R naught is about half, at least at the current data, the R naught is about half of what the COVID-19 disease causes. So, around 1.3. And versus 2 to 2.5. So that just means the number, once somebody gets it, they spread it to way more people, double the number of people. Now then the question is, well, how dangerous is it to get COVID-19 versus the influenza A or influenza B? And that's still something we're trying to find out based on very limited data, which the best really is from South Korea, where they did a lot of testing, so we can know how did things go for people who had minimal symptoms, and how did things go for people who are obviously very ill. So right now, unfortunately, it's still a very small cohort of very limited data, but there's some epidemiologists that project this is going to enter into our ecology and become a seasonal virus. I think overall, though, I think part of the problem we're struggling with as a society is that we have a fixation. We feel like we're in control of nature when it's actually quite the opposite. And so I don't think it should be demoralizing in that even if COVID-19 disease becomes a seasonal recurring disease, that there's every reason to think that we'll implement precautions for protecting one another, and we'll move on as a society, and we'll deal with it. Again, we're seeing just this incredible spike right now because we were unprepared as a society. But even in the worst case scenario that it becomes a seasonal epidemic, I don't see that shutting down gyms and facilities like this. But I do think there may be a shift culturally ongoing with regard to hygiene, basic hygiene measures.
Okay. Yeah, thanks for that. We have a lot of questions that are in the same vein. I'll try to lump them all into one single question. So people are wondering, right now a lot of gyms are closed. They're completely vacant. They might be so for a week or 2 weeks or longer. Just by leaving the climbing gym alone, are you essentially going through a disinfecting process since there is a finite active period for this virus?
Absolutely, yeah. Right now we think that probably the virus can only survive on inanimate surfaces for 3 days. So you clean out the gym, no one's there for 3 days. I could mean clean as in no one shows up. Then based on every bit of available evidence we have, there's no active virus there. Again, the trouble is just that the nature of climbing, you go in, you climb multiple routes, you have one asymptomatic person who is shedding virus, now immediately the first person who came in the gym now contaminated every hold and surface for 3 days unless cleaned. That's what we have to be thinking. But as far as overall for shutting the building down, I don't think any special measures would be required upon reopening to prevent any contamination that occurred before.
All right. And in that vein, there's a great question here. I'll just read it out loud. We're speaking a lot about cleaning holds, but knowing that they are generally only taken off the wall to go through that cleaning process every weeks or so, it seems like we need to figure out an answer as to what we can do daily, not just when we take the holds down.
So I think this is going to be an opportunity for your entrepreneurial or minded climbers out there, or gym owners like you guys, to come up with new solutions. One of those might be some kind of UV light system, just going by, because of the number of surfaces, a number of areas that are potentially fomites, that there's going to be, need to be some new way of dealing with this. So yeah, but climber to climber, that's going to be pretty difficult. It's not like you can disinfect every surface between every single climb, as everyone is going through the gym. So that's going to be a challenge. But if you can reasonably try to ensure that the individual climbers are having good appropriate hygiene, then that will help. But the question that remains to be seen is the droplets coming from the oral route onto hold. That's going to be really difficult to control, and I certainly wouldn't advise anyone to start implementing a surgical mask policy, because we can't even get masks in the hospital right now. But that may be something that needs to be considered at some point based on availability.
All right, thank you. When we have a lot of questions coming in, and this will be a hard one for you to speak to, since to my knowledge, there isn't any actual study of this, but there are some reports of higher pHs deactivating the virus. Climbing chalk has potential for a higher pH depending on the variety and also its exposure with water. So it'd be great to hear your thoughts on whether the higher pH of climbing chalk can kill the virus.
So, in theory, you could say yes, but I mean, until somebody wants to do the study and get some funding and put together something to convince the whole community and the climbing community and the medical community that that's a reality, or that it has some efficacy, and that it's but more than just some efficacy, actual real efficacy, like 95% and above efficacy, then I would say absolutely can't rely on that. Can't rely on that at all.
Yeah. Yeah, and in a similar vein, or if you're not familiar with liquid chalk, it's a mixture of isopropyl alcohol and climbing chalk. There's some discussion about whether that's an effective disinfectant.
Yeah, so isopropanol is absolutely one of the disinfectants that will kill the virus if appropriately applied and allowed to dry. But are we talking? You have some liquid chalk in your hand. You grab a hold. Now that hold is clean. I mean, definitely not. There's no way you could make that assertion. I mean, if you completely covered it with liquid chalk, every bit of the hold, and it was evenly distributed, and then you allow it to evaporate, and then you did a study where you actually swabbed the hold and looked for the viral RNA, and cool, that's a cool study. I'd be down to collaborate on that, but until that's done, I would say that whole notion can't be relied upon at all.
And would you say similarly for personal hygiene, just the cleanliness or the cleanliness of your hands, if you are using liquid chalk personally?
So I mean, tough to say. Again, it's all speculation, right? Because personally, I just I don't like to have a feeling about things. I like to use science whenever I can. I mean, I have a feeling that if you distributed liquid chalk over every part of your hand like you would a hand sanitizer, and it does have enough isopropanol on it that, in a sufficient enough concentration, theoretically, that could work. But again, something that's never been looked at objectively, it's just preponderance. So until that's done, I would say, don't rely on that.
Okay.
I mean, why not just sanitize your hands with off-the-shelf hand sanitizer and then put chalk on it? It just seems like a much easier and more reliable.
Okay. Yeah, and it actually be interesting to hear you comment on for when using hand sanitizer, to follow, say, CDC guidelines, or what you might do in hospital. Would be covering both the backs and all surfaces of your hand, if I'm not mistaken.
Yeah, definitely. Yeah.
Yeah, which so if anyone is using liquid chalk, at least at the very least, maybe do that, but and not just your palms. A
Okay, someone
similar.
says that they have 60% isopropanol, so yeah, that wouldn't be enough. That wouldn't be enough to kill the virus. So yeah, no liquid chalk does not sanitize your hands. I think we could say that pretty definitively. I didn't. So thanks to whoever posted that.
A similar interesting question. This is back to hold cleaning or hold disinfecting. Someone uses an acidic wash for their holds. There's obviously chalk getting mixed into that environment, so it's altering the pH of the entire solution. Are there pH numbers that people should be paying attention to if they want to be extra diligent about disinfection, either high pH or low pH, whether you're using a basic or an acidic cleaner?
So the answer to that would be that is not that's not known. We can infer that if you're using a sufficient volume of disinfectant liquid, that it would overwhelm the effect of some residual surface chalk on the pH just because of mass action. So I would say, if you're using enough volume of disinfectant, I think it's unlikely to affect the pH in such a way that would inactivate the quality of the disinfectant. So again, I think I would point to the EPA. If there was a concern, then why not use a basic cleaning compound, and that way you know that the only thing that could happen is that it's a little bit more basic because of the hydroxyl group of the chalk.
Okay.
Just to be a kind of a common sense way of going about it. If you're using acidic, yeah, just switch to a basic. And again, there's like a ton of them on the EPA website to choose from. So.
All right. Got a number of questions here also on what sort of PPE any of the climbing gym staff should be wearing while cleaning holds or even just cleaning the entire gym.
So what we're using in the hospital right now is an N95 respirator that has to be, a good fit. So I actually had a beard that I got a little stubble now, but you have to have a good seal around your mouth. You have to have an N95 respirator. And then, gloves. I guess one of the effects of the N95 respirator is that you don't touch surfaces and then inoculate yourself or touch your nose or mouth. So that's important. But as you're cleaning and you're creating droplets in the process, having that available would be wise. Now again, we have nationwide shortages. Even in the ER, we're using UV light to disinfect our N95 so we can reuse them day to day. I wouldn't say this, it's the best time to go out and hoard a bunch of N95 masks. But that would be the best. That would be the best way to protect yourself. If that's, I would say probably the best thing at this point would be just to let things sit out for several days rather than start to implement that at this point. But I think at some point down the line, while we're in the recovery stage and supply chains are a little bit more robust, that wouldn't be a bad idea. And actually, you can get them at the hardware store. I just found some in my shop that I bought previously. So they're available to non-medical vendors to have, which is probably a good idea.
Great. This will be a tough question, but it kind of builds on this staff and cleaning issue. People would like to know how they can be sure that the staff that are coming in to reset or clean the gym don't have the virus themselves.
No possible way of knowing. Again, that's part of why the epidemic is, the pandemic is as bad as it is that even, there was a study that came out of one of the cruise ships that was infected. They found that on this one single study, so take that with what it's worth, they swabbed every single person on the cruise ship coming off, and found that about half confirmed cases were asymptomatic. So again, probably quite a few participants on this webinar right now already have been infected and they don't have any symptoms. So there's just no way. So that's part of the challenge that we're going to face, is that, preventative precautions, and assuming that people have it and doing everything we can to try to reduce the chance they're going to spread it is the best we can do at this point.
Good. We're getting close to the end of our time. So the last question, unfortunately, is not the happiest question, but I think it's an important one. Someone's asked, should we be prepared for multiple rounds of closures? So this might go back to that question of how long will this pandemic be affecting the world?
Yeah. So you're asking me to look into the future. So all I can do is give my best guess, but I think a lot of closures are going to be mandated. I don't think they're going to be the community having to make that choice themselves, only because, like we're seeing right now in Tucson, they are they're just shutting down any areas where people are congregating, like gyms, restaurants, bars, anywhere where there's a number of people coming in and out. So I think there's, right now we should be doing everything we possibly can to reduce that risk of transmission, but ultimately I think there's going to be mandated closures in most areas. I just saw somebody's comment, which I just wanted to double back down onto, pressure washing. Good point. Right now we definitely shouldn't be pressure washing anything. It would be a terrible idea, just creating aerosols from inanimate surfaces. So if the quickest way to infect more of your staff is to pressure wash holds at this point. So definitely do not pressure wash any surfaces, because you're going to create a plume of virus.
Yeah. All right. Well, yeah, thank you so much for sharing all the thoughts and answering questions. For anyone who didn't get their question answered, the CWA will definitely be going forward to discover answers to any of the questions that are still hanging, all of the cleanliness, how many people should be in gym types of questions. And so we're going to keep an open dialogue with all of our members and keep publishing information as we find it. Laura will let you know a little bit about what we'll be doing in the future.
Yeah, and before I do, just one thing, Tiffany Bertelson had a good suggestion here, us asking Sean, what can climbing gyms do or encourage our community to do to help support our local healthcare professionals and systems?
Well, right now would be definitely don't hoard PPE. If you have access to PPE, don't hoard it. Don't buy it. Generally, if you're not interacting with patients or high risk populations, please, if you have any, give it to, drop it off at one of your local emergency departments or fire departments, ambulance services, something like that. That would be the biggest thing right now, because that's the most challenging thing we're facing, is that a lot of us are going to be exposed as healthcare workers, and unfortunately a lot of us are going to be taken out of the fight because we got infected. Some of that's inevitable, but some of that is preventable. So that's one big thing we could do, I think, as a community, be cognizant of PPE. If you have any extra, donate it, but certainly don't hoard it. Beyond that, I know there's a lot of healthcare workers in the climbing community, so just want to thank you guys for all your hard work too.
Thank you. So in terms of what the CWA is doing and our next steps, again, we went over this on the last webinar, so we're just going to continue to be trying to share as much information as we can, and provide opportunities for you guys to connect, ask each other questions, and get experts on these calls to help answer questions. So we'll be providing updates via email. You can sign up for emails at climbingwallindustry.org/lines. We're going to be posting updates on social media, continuing to host calls, and we put our coronavirus resource hub live last Friday. So climbingwallindustry.org/coronavirus is going to be your best centralized location to find all of our resources on this crisis.
All right, thanks, Laura. And I also say remind people that on that coronavirus resource, we will have recordings of all of these webinars. So if you need to go back and revisit any ideas, or if you'd like to share it with anyone who wasn't able to be present, that's where these will live. And as I mentioned a couple times on the call, we're trying to contact manufacturers and and figure out ways to provide the best possible guidance for you about all of these questions around cleaning, how many people should be in a gym, what should we be doing in the future. This is obviously a rapidly developing situation, and our knowledge base of what the best practices are also evolving. So there's a lot of information out there, and as Dr. Murphy mentioned, the EPA has a great list of cleaning agents that they know will deactivate SARS-CoV-2, and we'll be doing our best to publish industry-specific guidance, whether that is about ropes, holds, rental gear, any of those kind of questions. So keep an eye on that. It probably won't be out tomorrow because we'll need an amount of time to gather the best possible and most accurate possible information. But if you guys have any specialization in these areas, definitely get in contact with us, share your ideas, share your thoughts, and you'll help us create the best possible guidance that we can for the industry. And so feel free to get in touch with us at any time with any of these types of questions. And hopefully we'll see you at our next webinar, which will be this Thursday, and we'll be covering staffing and some of the legal issues about employee law and gym closures. Thank you very much, everyone, for your time, and we'll see you on Thursday, hopefully.
Thank you, guys.